Okay, so I'm going to introduce Dr. Catherine Sweeney. Catherine is lead for faculty development at the Medical Education Unit in UCC, and she's also joint program director for the MSc in Health Professions Education. Catherine moved into full-time medical education in 2019, and prior to that had a career that spanned the areas of general practice, palliative care, and older persons care. So thanks very much, Catherine, for agreeing to come along today for interview.
Not at all. I'm delighted to be here.
Great. I'm going to start out with a very general question, if that's okay, and really it's just to get your views on maybe best practice for how an effective mentorship program for doctors might be organised.
Sure. I mean, I think this is really key to getting a mentorship program that's successful. It's really important at the outset, I suppose, to know what the program's about, what your objectives are, what you want to get from it. And, that informs everything thereafter. So having clear objectives means that you can then design and put work into the design of a program that meets and aligns with those objectives. So, for example, if you want a particular outcome, you need to make sure that the activities that happen in the program align with that particular outcome. And I suppose I don't want to get granular and get down into detail on this, but it's kind of very much aligned with that idea of what we call constructive alignment in medical education, where we make sure that our learning outcomes align with what we do with the students. And then once you have your design right, you need to start think about how you're going to evaluate it and how you're going to be overseeing it on an ongoing basis to make sure that things are happening, that things that are happening are aligning with what you want to happen, and that the outcomes are as you wish. So it's that whole idea of following through, of iteratively changing your program if you need to, based on evaluation, based on what's happening, based on things that go wrong, because things always do go wrong, or there are unanticipated events that happen. And it's that idea of kind of ongoing oversight, I think, is really important in this kind of program.
Okay. And before we get into the scope of mentorship in a bit more detail, you've mentioned an oversight group or an oversight committee. Who are the sorts of people that you think should be included in a committee like that? And how active or how important within the overall program are they expected to be?
I think it's a really important group. I mean, I think, especially when something like this is in its infancy, it's really important to get it right early on, because the first few years of it will determine its success or its failure. And, if you want people to engage with it in the future, the experiences need to be good right from the get-go. So having an active oversight committee that consists of, I suppose, a range of stakeholders, really, you need people who are involved in the program, the setup of the program, having a mentor, having a mentee on the committee would be important too, because their voices and their perspectives are going to be really important there too. So you're looking at people from a range of backgrounds with levels of understanding of different perspectives of this.
Okay. You were talking about, I suppose, the scope of mentorships, and that fact that actually no two relationships are likely to cover the same territories. How broad do you see the scope of mentorship being?
I mean, mentorship can be broad, but it can't be too broad either. And I think it's important, this is a piece where having clear expectations at the outset is really important. Within a mentorship relationship, is people knowing what the scope is of this particular relationship between this particular mentee and mentor. I suppose the common things that mentorship relationships deal with are skills development, education needs, career development, work-life balance. It would be a common enough one, and networking. They would be the kind of common things. And sometimes it's almost easier to think about what mentorship isn't, and to think of where the boundaries are, because I think that's really important. As doctors, we tend to spend a lot of time as advisors. We advise patients all the time. We advise junior doctors. We advise all sorts of people, and we're probably constantly throwing out unwanted advice in our home lives as well. But being a mentor is not the same as being an advisor. Advisors tend to be very much in a position of a one-way flow of information, or a predominantly one-way flow, where the advisor is giving advice. Mentorship is very different. Mentorship needs to be a two-way flow, where the mentee is heard and actively listened to, and their needs are being met as well. And so it needs to be, fluid, organic, but at the same time, there have to be boundaries put on that. And I mentioned already that as doctors, we're also very good at being advisors, but sometimes we're not very good at boundaries. And I think we can try to be fixers and try to fix every problem that comes our way. We've got a mentee maybe who's having some health problems, either mental health or physical health. And it can be tempting, if you have a bit of expertise, or someone, or one of your friends is a whatever, that you refer them along, and you can't kind of almost act as a doctor in that role, and you're not a doctor. And I think it's important that that boundary is put there, that that's not your role. You're also not the employee assistance program representative. That's there for a reason, and that should be used appropriately. And you're not there to remediate problems that might be happening in the workplace with the, if there's a remediation issue needed in terms of performance around the mentees. So kind of keeping a tight hold on the boundaries, I think, is quite important in this context.
So, I mean, it sounds as though the mentor should be maybe expected to help point the direction towards a resolution to the problem, but where it becomes clear that the person's hand has to be held and guided through the issue, that's really where the issue has to be moved on to occupational health or EAP or whoever else. Is that kind of where we're getting towards?
I think so. Yeah. And I think I think that can be kind of, upfront in terms of, I think this is a place where preparation really sets it up for success, that people come in prepared, knowing what it is and what it isn't, what they can expect from it. And the first meeting is really an important piece, and having structure is important in mentorship programs, having an idea of how, what are the boundaries, what are the expectations, what is expected of me, what are my roles and responsibilities as a mentor or as a mentee, and where do they finish, and where should we be moving things on to somebody else?
I suppose one of the questions that I have for you is, in one of our earlier interviews, there was a chat about the traditional model of mentorship, that it's really based on chemistry and it's not terribly structured. It's quite informal. It can happen in car parks and things like coffee shops and that sort of stuff. And then the difficulty of translating that into a program, which I suppose by its nature has to be a bit more structured. I mean, what's your feeling on that balance between an informal relationship and a very structured one, and where should mentorship sit in that?
I think therein lies the challenge, doesn't it? I think that an informal kind of relationship is a really important piece to aim towards, but having some structure on it. So you can still meet your mentee in a coffee shop. It doesn't have to be sitting in an office or on a screen or whatever, but it's allowing, it's having this structure, I suppose, somewhere there as a kind of a rough agenda, making sure that you keep on some kind of track. But it's more than just a casual chat every now and then, touching base on how are you doing. If for mentorship to really reap its full benefits, it needs to be a little bit more than that too, and it needs to maybe occasionally ask the difficult questions, or to probe a little bit more, or to challenge people a little bit more. I mean, there's feedback involved, which sometimes might be constructive feedback. So I think it's a kind of a little tricky, slightly tricky balance, and I suppose something that probably comes with a bit of experience. And I'm sure, it won't always be perfect all of the time, but it's trying to get that. And I think it's important also that informality is there somewhere, because we don't want it to be a hierarchical piece where you've got a consultant or a senior doctor in a senior role who's in a position of power, and then you've got this less powerful junior doctor who might need a reference someday, or who's worried about how they're going to be perceived. So it's trying to keep it so that these two things are separate, that that you're not relying on that person necessarily for your references in the long term, that they're more of a colleague in a collegial kind of sense.
And I guess, I mean, I suppose our worry in that regard is that, you know, while people have asked to get an idea as how they might structure their meetings with people, and we've provided that, but at the same time, we don't want people to be stifled by it. And I think that flexibility is an important point. My last question to you, and this one is just briefly. I mean, you know, obviously we enter a program like this with the optimism that every relationship is going to be a success, but I suppose the reality will be that for any number of reasons, mentors and mentees may run into difficulties. You know, from an organizational perspective, how is that best managed?
Yeah, well, I suppose just as a starting point, setting it up to succeed is important, and we've already mentioned that that having clear expectations, that people being orientated to the program, and knowing what the structures are and how they contact a mentee if they have to cancel a meeting. All those things are important in terms of kind of it working. But where there is a problem, I think that's where the oversight committee comes in. I think it's going to be important that it's easy to contact them, that they're available, that they're not just somebody who, you know, an email that's looked at once a month by somebody, that there's actually a responsive person on the end, so that problems can be, I suppose, you know, if troubleshooting is possible, and the relationship can be kept on track, well and good. But if it can't, and it's clear that people need to move on and end the mentorship relationship, that can happen in a reasonable fashion,
Okay.
you know, where possible.
Listen, Catherine, thanks very much for the time this morning. It's been really helpful to look at the organizational approach to a mentorship program.